Aspirin Ec, also known as aspirin, is a medication used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches. It can also reduce pain and swelling in conditions such as arthritis. Aspirin is a type of salicylate and a nonsteroidal anti-inflammatory drug, NSAID. It works by blocking a certain natural substance in your body to reduce pain and swelling. It is important to consult your doctor before giving aspirin to a child younger than 12 years old. Your doctor may also recommend taking a low dose of aspirin to prevent blood clots, which can reduce the risk of stroke and heart attack. If you have recently had surgery on clogged arteries, such as bypass surgery or coronary stent, your doctor may direct you to use aspirin in low doses as a blood thinner to prevent blood clots. When taking Aspirin Ec for self-treatment, follow the instructions on the product package. If you have any questions, ask your doctor or pharmacist. If your doctor has directed you to take this medication, take it exactly as prescribed. Take this medication by mouth with a full glass of water unless directed otherwise. Do not lie down for at least 10 minutes after taking it. If you experience stomach upset, you may take it with food or milk. Swallow enteric-coated tablets whole and do not crush or chew them. The same goes for extended-release tablets or capsules. The dosage and length of treatment are based on your medical condition and how you respond to treatment. Read the product label to find recommendations on the number of tablets you can take in a 24-hour period and how long you can self-treat before seeking medical advice. Use the smallest effective dose and consult your doctor or pharmacist if you have any questions. If you are taking this medication for self-treatment of headache, get medical help right away if you also have trouble speaking, weakness on one side of the body, or sudden vision changes. If you are taking this medication as needed, remember that pain medications work best if they are used as the first signs of pain occur. You should not take this medication for self-treatment of pain for longer than 10 days. You should not use this drug to self-treat a fever that lasts longer than 3 days. In these cases, consult a doctor because you may have a more serious condition. Tell your doctor promptly if you develop ringing in the ears or difficulty hearing. If your condition lasts or gets worse, tell your doctor promptly. If you experience upset stomach or heartburn, it's important to contact your doctor or pharmacist. It's important to remember that your doctor has determined that the benefits of using this medication outweigh the potential risks. While many people don't experience serious side effects, it's important to seek medical attention if you experience severe nausea, vomiting, easy bruising or bleeding, difficulty hearing, ringing in the ears, signs of kidney problems, unexplained tiredness, dizziness, dark urine, or yellowing of the eyes or skin. Additionally, seek immediate medical help if you experience severe abdominal pain, black or tarry stools, vomit that looks like coffee grounds, trouble speaking, weakness on one side of the body, sudden vision changes, or a severe headache. In rare cases, a serious allergic reaction may occur, so seek immediate medical help if you experience fever, swollen lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so it's best to consult your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA, and in Canada, you can report side effects to Health Canada. Before taking Aspirin Ec, it is important to discuss with your doctor or pharmacist if you have any allergies, especially to salicylates or other pain relievers. Also, if you have bleeding or blood clotting disorders, kidney or liver disease, stomach problems, asthma, nasal polyps, gout, or certain enzyme deficiencies, it's essential to consult with a healthcare professional before using this medication. It's important to be aware that aspirin may cause stomach bleeding, especially when combined with daily alcohol and tobacco use. Limiting alcohol intake and quitting smoking can help reduce this risk. Also, inform your doctor or dentist about all the medications you are taking before having any surgery. For children and teenagers under 18 years old, it's important to avoid taking aspirin if they have chickenpox, flu, or any undiagnosed illness, or if they have recently received a vaccine, as it may increase the risk of Reye syndrome. If you notice changes in behavior along with nausea and vomiting, it may be an early sign of Reye syndrome, and you should contact a doctor promptly. Older adults are more sensitive to the side effects of this drug, especially stomach or intestinal bleeding and ulcers. Aspirin is not recommended for use during pregnancy, especially after 20 weeks until delivery, as it may cause harm to the unborn baby and complications during labor. However, low-dose aspirin may be used under the direction of a doctor for certain conditions during pregnancy. It is important to discuss the benefits and risks of using aspirin with your doctor if you are pregnant or planning to become pregnant. Aspirin passes into breast milk and may harm a nursing infant, especially when used in large amounts for pain or fever. It is best to consult your doctor before using aspirin while breastfeeding, although low-dose aspirin for heart attack or stroke prevention may be considered if directed by a healthcare professional. It's important to be aware of potential drug interactions that may affect how Aspirin Ec works for you. Talk to your doctor and pharmacist about all the products you use, including prescription and non-prescription drugs, as well as herbal products. Some products that may interact with Aspirin Ec include mifepristone, acetazolamide, blood thinners, corticosteroids, methotrexate, and others. Before using Aspirin Ec, consult your doctor if you have recently received certain live vaccines. Also, be cautious when using other pain relievers or cold products, as many medications contain NSAIDs that can interact with Aspirin Ec. Daily use of NSAIDs like ibuprofen may decrease Aspirin Ec's ability to prevent heart attack or stroke, so it's important to discuss other possible treatments with your doctor or pharmacist. Lastly, be sure to inform lab personnel and all your doctors that you are taking Aspirin Ec, as it may interfere with certain lab tests. If you suspect an overdose and notice serious symptoms like passing out or difficulty breathing, it's crucial to seek immediate medical help. In the United States, you can call your local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. Symptoms of an overdose may include burning pain in the throat or stomach, confusion, changes in mental/mood, fainting, weakness, ringing in the ears, fever, rapid breathing, changes in urine output, seizures, or loss of consciousness. If you take Aspirin Ec regularly or in high doses, your doctor may want to do some tests to check your liver and kidney function, blood count, and salicylate level. Make sure to keep all your medical appointments and consult your doctor for more information. There are various types of aspirin products available, some have special coatings and others are long-acting. It's best to ask your doctor or pharmacist to recommend the most suitable product for you. If your doctor has prescribed Aspirin Ec for you to take on a regular basis and you happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed one and take the next dose at the scheduled time. Do not take a double dose to make up for the missed one. When storing Aspirin Ec, make sure to keep it at room temperature and away from moisture and light. Different brands may have different storage requirements, so be sure to check the product package or ask your pharmacist for specific instructions. Avoid storing it in the bathroom and do not use any aspirin product that has a strong vinegar-like smell. Keep all medications out of reach of children and pets. When it comes to disposing of Aspirin Ec, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.